Hey guys, want to make a short video here about thyroid testing. Just wanted to distinguish between regular medical testing versus functional medicine testing. In the field of regular medicine, they'll typically run a screening test for thyroid stimulating hormone, which is TSH. Um, it is a pituitary marker that just kind of lets the clinician know what is going on with the thyroid indirectly. So it's kind of an indirect test. It's like your pituitary in your brain looking down at the thyroid and letting you know how it's doing. So under normal circumstance, it provides a feedback loop back to the thyroid to kick out more or less thyroid hormone. And so a lot of times the regular medical practitioners will use that as like an indicator to see if you're high or low. It has an inverse relationship to how your thyroid's doing. So in other words, if you have a high TSH, anything I would say over 3 or so, that would say that your thyroid itself is functioning too low. So it's got like an inverse relation there. So that's a screening thing. Functional medicine practitioners don't use that too much. It's just kind of a side note. And sometimes regular medical practitioners will use a T4 level, which basically is kind of an indirect, latent form of thyroid hormone. So we call that inactive. It has to be activated by the body. And when it turns active, it turns into T3. So a lot of times in medicine and or functional medicine, we'll use total numbers and we'll use free numbers. So the total numbers, like if you see a total T4, that's a total saturation, or that's not a saturation, but it's a total amount floating around inside you of T4. And if you run a free T4, that will tell you what's actually floating in the bloodstream to be utilized by the thyroid. So in my practice and in other functional medicine practices, we tend to run the free levels of these hormones. That way we can actually see what's floating around and actually being theoretically utilized. And so another marker that I would talk about is the T3, specifically free T3, which would be the active thyroid hormone. Most medical practitioners don't look at that parameter. Maybe endocrinologists will look at that because they get a little bit more involved. You have to remember in the standard regular medical field, it's more of just a screening process to see if they have to send you to endocrinology or something like that. Versus if you're actually treating, then functional practitioners usually run the whole gamut of tests to kind of see functionally like what is your body actually doing. So the free T3 represents the active circulating thyroid hormone that is actually being utilized or theoretically utilized in your body. So that's the most important level, if you will, that lets the clinician know exactly where you stand with the available active thyroid hormone that your body could be using. So there's that. And then, so we use that. I mean, functional medicine wise, we use that as the prime mover and shaker marker to distinguish how well therapy is progressing, if you need therapy. So we use that as a measurement tool to see what is going on in reference to thyroid health and the rest of your body. So there's a couple other parameters I just wanted to touch base on real quick. The other one is called reverse T3, which I usually explain to patients. The reverse T3 is the body's attempt to convert T4 to T3, and in doing so, it creates kind of like a dud molecule in the sense that it has very little to no binding ability to the thyroglobulin receptors in the thyroid. So this is an indirect, it's kind of like a direct marker. I don't know which way to say that, but it's a marker that lets you know your conversion. So if you're converting really bad from T4 to T3 active, and that number jumps over 20, 9 times out of 10, you're not converting well. 9 times out of 10, if you're throwing T3 into the body, it's not being utilized. And so it's just a measurement to let the clinician know how well your body's actually using, the hormones floating around. Most of the time, if that number goes elevated, the reverse T3 goes elevated, it's adrenal stress, some form of physical, mental, emotional, intellectual, sleep deprivation, stress, that usually drives that number up. So usually that's the way to approach that. And the final marker is TPO, thyroid peroxidase antibodies, and that just checks to see if your thyroid is actually attacking itself. And in that kind of situation, you have an autoimmune situation, and that lets the clinician know if you have Hashimoto's thyroid or not. And so that's another useful marker if there needs to be symptom management with autoimmunity. Sometimes functionally that will lead the clinician to run like more of a full body autoimmune test or panel, just to see if you have any other markers for lupus or rheumatoid or other scleroderma problems, connective tissue disorders or anything. And then the other thing is, once in a while the clinician can run some other autoimmune markers that deals with thyroglobulin antibodies, that just kind of measures for other autoimmune conditions like Graves' disease or hyperthyroid. Most of the time you can kind of tell from clinical examination, physical examination, and otherwise historically also, if the patient has Graves or hyperthyroid, just based on symptom sets that the patient would talk about. So anyway, and then getting into treatment, a lot of times regular doctors will use inactive T4, which you've heard of, levothyroxine or Synthroid or those kind of medicines. But then that requires the body to actually convert it to T3 so that it will become active. And so people with conversion disorders, which a lot of people have, they're not very successful using a one ingredient approach, which would be T4 then. So then some functional medicine providers use combo products that has T3, which is the active thyroid hormone already activated. So once it goes in, your body just starts using it right away, combined with an inactive T4, which would then give you more of a well-rounded approach by using a combo medicine. And a lot of times, like Armour Thyroid, NP Thyroid, West Thyroid, Nature Thyroid, even compounded at your local compounding pharmacy, could do stuff like that. And then that gives you a more well-rounded approach at tackling some of your thyroid symptoms, and also just addressing the levels on the lab analysis. So I could go on forever, but that in a nutshell is the gist of how clinicians, or at least functional medicine clinicians, approach that subject matter. Feel free to leave any comments below, and also it would mean the world to me if you liked and subscribed, and I will hit you up the next time. Take care.